Dr. Eitam Amir, thank you so much for joining us from Toronto. Can you tell me a little bit about you?
So yes, thank you. Thank you for the invitation to be here. My name is Eitam Amir. I'm a medical oncologist. I'm also the head of the solid tumor oncology program at Princess Margaret, which is the largest cancer center in Canada.
You've had an extensive career when you had a chance to work on different projects. Can you tell me about maybe one project that really stayed with you because of the results that it had brought?
If you wanted me to choose one, it probably is now over a decade ago, but it was part of my PhD. So at that time, breast cancer that had reoccurred was treated according to the characteristics that it had when it was initially diagnosed. So we actually designed and ran a study where we decided to rebiopsy disease that had reoccurred in about 120 women. And we actually found that the characteristics of these diseases actually could change in 30 to 40% of cases. But the change occasionally meant that doctors chose different treatments in about 1 in 6. And that's probably the most important study that I have led, in that rebiopsying cancer that reoccurs, especially breast cancer that recurs, is now a standard of care. And it's certainly been the most gratifying single project that I've been involved with.
I wanted you to say that because I feel that we grasp the importance of research. So can you tell me what you're working on now?
Because obviously I treat breast cancer, and the outcomes of breast cancer these days is actually pretty good, we are looking now at optimizing treatments. We have very good treatments already, and we need to use them in the best possible way. That means two things. That means identifying some people who might need less treatment or might need no treatment. So that's one element of it. And then to identify those on the other end of the spectrum who might actually need escalation of their treatment. And in addition to that, there's also the concept of making sure that treatments reach the appropriate patients. There's some people that don't get the treatments that they need, even though it's available. And if we could just get everybody who needs that treatment to receive it, we could probably improve outcomes quite a lot. So you want your patients to have one of the following outcomes. You either want them to live longer, or if you want them to live better. So if they're already living very well and they're likely to be cured, the one area that you can really improve is to improve their quality of life. And that often means less medication, not more.
And in a research like this one, how important is a foundation like Roses of Hope?
When you start asking questions of, can we use cheaper drugs? Can we use fewer drugs? There's actually less inclination to fund that in the standard industry-based way that drugs are funded. So that leaves us with philanthropy and foundation work, such as the one that you described.
Well, thank you so much for taking the time to talk with us, because I feel that even though when we participate in campaigns, when we donate, we know, that our aim is to do better and to help. But here we have a concrete idea of how we're helping. And I feel it's amazing that women would know that, the next time they donate a bra or they decide to buy one of the t-shirts. So thank you so much.
Thank you very much.